Mr. Patrick is an 87-year-old male admitted for pneumonia. He has medical history of COPD and renal insufficiency. He has a right forearm IV running normal saline at 75 mLs an hour. He is ANO ×2 to self and location, not to date, follows commands, interacts appropriately, a little slow response. Regular rate and rhythm, cardiac. He has a PMI slightly displaced to the left, +2, pedal edema, cap refill less than 3 seconds, try and elevate. Legs with pillows, possible need for some TED hosing. Respirations, 24 breaths per minute. He is using accessory muscles, crackles in his upper lobes bilaterally, diminished breath sounds at his bases bilaterally. Wet productive cough with yellow sputum. I would just verify if he doesn't need a sputum culture and make sure that the culture came back resistant to the antibiotic that he's on, the cefazolin. Use of incentive spirometer, and keeping high Fowlers as tolerated. Positive bowel sounds, non-tender, abdomen slightly distended. Last BM was 3 days ago, complaining of poor appetite. GU, he has urgency, frequency, and hesitancy. Urine output in the last 8 hours is about 350 mLs, so about 43 mLs an hour. UA was negative. He has dry, fragile, intact skin, dry mucous membranes. He is hard of hearing on the right side. He does not have his hearing aid. Does have his glasses, so you can use pen and paper if unable to verbally communicate. Notify MD of H&H lab values. So his H&H red blood cells came back low. Notify for kidney function test, BUN and CR was increased. Possible nephrology consult for the renal insufficiency. Pain meds for 5 out of 5. Gouty pain, burning constant pain in his feet. Verify parameters of Senna for constipation, if he needs also a stool softener along with the stimulant laxative. Dietitian for increasing fiber in his foods for the constipation and possibly for the poor appetite. Possible consults for pulmonology or follow-up for COPD. Assess need for supplemental oxygen, even though he does have COPD. Respiratory therapy for CPT and possible neb treatments. Psychosocial, contact his family if they're able to bring the hearing aid. If no family, referral to social work, also for his disposition for discharge. PT as tolerated, activity as tolerated.